Hello, I hope everybody is staying safe. I'm Paul Beckwith, and in the previous video, I talked about the power of pandemics to shape human civilization. In this video, I'm going to jump right in and talk about the history of pandemics to start off. So this is a great article called Visualizing the History of Pandemics. So you can Google that and have a look at it. And what you see is, you see a timeline here going back about 2,000 years. Okay, and you see a whole bunch of different pandemics of various types occurring at different times. And the size of the virus here is basically indicating the size of the pandemic. Now, while I'm looking at this timeline, I would recommend that you bring it up on your own computer to have a look at it, and also Google world population estimates. And here's a timeline which gives the population, the global population, from various estimates, various papers, at various times back in history. So what you can do is you can see the influence that the particular pandemic had on the globe as a fraction of the total global population. So we can look here, the Antonine Plague, 165 to 180, okay, 5 million death toll. Okay, so if we go back to about, if we go on the world population map and go to about 200, we can see there are about 200 million people or so on the planet. So 5 million over 200 million, that would be 1 in 40. That was about 2.5% of the global population. So you can do that for each of these. So here's the plague of Justinian, 30 to 50 million estimated death toll, the 541 to 542. So if you go back here, 541, roughly 200 million people or so on the planet. So now we're talking about 30 to 50 million. 50 million would be 25% of the global population affected by this plague. So these were big deals. These were enormous. So we have Japanese smallpox, and then we have the biggie, the Black Death, or the Bubonic Plague. Between 1347 and 1351, it killed an estimated 200 million people. So if we look at 1350, 1340, 1350, we may have 300, high 300s to 400 million people on the planet. 400 million people on the planet, 200 million deaths. So this plague killed about half of the population of the planet. Huge. And then smallpox in 1520, 56 million. 17th century plagues, 18th century. So they're happening at periodic, not quasi-periodic intervals. There's a cholera outbreak here. This is the Spanish flu, the biggie most recent biggie from 1918 to 1919, 40 to 50 million people killed. So if you look at the global population back then, at the 1913, about 1.8 billion or so. So 1.8 billion, 1.9 billion. Okay, so 2 billion would be, this would be 20 to 25% of the global population. Okay, actually no, it's a lot smaller, 2.5%. Okay, 1.5 billion would be 1,500 million divided by 50. Okay, so a couple percent. Russian flu, and we've got HIV. I'm surprised myself. I didn't realize HIV was 25 to 35 million. Huge numbers of people spread from 1981 to present. Okay, and then we can look at what's going on now. Now we have this novel coronavirus, and here's where we are now. It's rapidly spreading. It's just starting, basically. It's ongoing. very, very small numbers right now. We'll see where it goes. So if you look at the death toll from the highest to lowest, again, the Black Death is highest, the granddaddy of plagues, 1347 to 1351, 200 million people. That represented about half of the global population at the time. If you go to 1350 over here on the scale, you have about 400 odd million. So, it's about half the global population. And we have the smallpox, Spanish flu, plague of Justinian, and so on and so forth, okay? Now it says here that the Black Death wiped out 30 to 50% of Europe's population. It took more than 200 years for the continent's population to recover. These things significantly changed the world. And you can read a little bit about the historic, history down here. Okay. Now here's where we are now. Now this was about 3 hours ago. 194,000 cases from, this is the Johns Hopkins. If you Google Johns Hopkins coronavirus map, you can bring up this and have a look. So about 3 hours ago, it was this number, and let's see what the latest is. It's so the number is being updated. It's a couple thousand higher, and you can check your individual country. I'm looking, Canada's 478. This is a jump of about 40 people so far today in Canada. Okay. I want to talk about, the big question is this thing going to be, is there a seasonal dependence? Will cold countries that are being hit hard now, will they get some reprieve when the weather warms up? So if you look at the data, and I showed this in some previous videos, this is the world confirmed cases. Warm countries are down here. Warm countries seem to be following a smaller slope, 14% daily increase, as opposed to, Italy is over here, and it's a 22% daily increase, and we've got Spain up here, and it was showing a 38% daily increase. Okay, so the only way to bring these down is by social isolation. Basically shutting down, isolating people into houses just to stop the spread, to bring these things down. This has to be done everywhere, and the quicker you do it in your country, the better the outcome will be, allowing your health systems to cover the people that are sick. Okay, so I tweeted a whole bunch of things recently. If you're on Twitter, make sure you follow my feed at Paul H. Beckwith. So basically, how changes brought on by coronavirus can help tackle climate change, temperature, humidity, and latitude analysis to predict potential spread and seasonality, the role of absolute humidity on transmission rates, study in the U.S. on influenza, seasonal variation, and a calendar on infectious diseases. And this is a great article on waxing and waning diseases with the seasons. Okay, so those are some of the articles that I'm going to discuss. So this is a very good overview. It's called, I highly recommend that you have a look at this article, Why Do Dozens of Diseases Wax and Wane with the Seasons, and Will COVID-19? So this basically looks at the questions as to why why various diseases wax and wane. Okay, it's not clear why they do that. There's many different hypotheses for it. There's a multitude of theories. Is it the pathogen itself changing? Is the virus itself changing? The physical nature of the virus, is it more susceptible to spreading? And how does the environment impact that? If you're in a higher temperature environment, a higher or lower humidity environment, how does that affect it? Human behavior at different parts of the year. For example, influenza, which we know is seasonal, the flu virus, might do better in winter because of humidity is low, temperatures low, people are closer together, or their diets might change, vitamin D levels, the amount of immunity, the human immune system may change with the seasons, becoming more resistant and more susceptible to infections based on how much light our bodies experience. There's all of these different things. So there's what do we here? There's a calendar of epidemics, and I'll talk about that paper in a minute. Calendar of epidemics. You can have a look at the scientific paper, but at least 68 infectious diseases are seasonal, according to this paper, but they're not in sync. So here we have winter, December, January, February, spring, March, April, May, summer, June, July, August, and autumn, September, October, November. And you can see different outbreaks. So here's a smallpox outbreak, 1937, peaked in May. Rubella, 1971, peaked in May. Mumps, over here in April. Hepatitis A, over here. Pertussis, right here. Influenza in February in the U.S. Measles, a few months later. Chickenpox, basically in the summer. Polio in the fall. Okay, so there's all of this data that's in the paper, and there's lots of different reasons why there might be seasonality. Okay, those are the key things. And if we knew what suppressed influenza to summertime levels, right, in North America, for example, that would be a lot more effective than any of the flu vaccines that we have. Okay, there's 4 human coronaviruses that cause colds and other respiratory diseases. 3 of them have marked winter seasonality, with few or no detections in the summer. Okay, but we don't know how COVID-19 will behave yet. But there is a study that argues that the sustained transmission of COVID appears to occur only in specific bands of the globe that have temperatures between 5 and 11 Celsius and 47 to 70% relative humidity. Okay, but let's have a look at what some of those studies show. So this study is a calendar of epidemics, seasonal cycles of infectious diseases. It's a 15-page paper published a few years ago, 2018. And what it does is it looks at all of the different diseases and things, all of the different pathogens, alphabetical order, chickenpox, African sleeping sickness, okay, Ebola, herpes, all kinds of nasty conditions, malaria, and it talks about, here malaria, there's a spectrum of seasonal strength. Some regions have strong seasonality, other regions don't have it. Okay, there's all kinds of other things here, okay, with the seasonality. So that's key, and it goes into a lot of details and some of the reasons and vectors and things, and I'm not going to cover it in any more detail. I want you to know it exists. There's this paper here. These are all accessible, open access. You can just Google the title. Absolute Humidity and the Seasonal Onset of Influenza in the Continental United States. Okay, and I'll just go to some of the key findings. This is the percent transmission versus the specific humidity. So as the specific humidity gets higher and higher, this is the kilograms of water in a kilogram of air. So this is, 1%, 2%. As there's more and more water vapor in the air, the transmission through the air drops off sharply because, you sneeze, the particles get larger quickly because they pick up humidity from the air and they drop out quickly, so the transmission drops. This is the virus survival versus specific humidity, also drops off significantly. This is the R0, or the spreading factor, how it varies. It drops off significantly with specific humidity as well. So here's some data. This is the specific humidity as a function of month through the year for various states: Arizona, Florida, Illinois, New York, Washington. And you can see how the specific humidity increases significantly in the summer, and that reduces transmission. And this is the R0, how it drops off. It might be 2.5 here in the winter, which is what COVID is, and it drops off for these other things. I'll continue. Thanks for listening.